Human life is never more tenuous than at its very beginning.
Most people leave the hospital with their baby, but I know that I won't. That's really hard.
A moment that's filled with joy and with peril.
Damn, that doesn't sound good.
Did we deep suction her at all?
In the dangerous business of giving birth,
If we're not as quick as we need to be, we could lose this baby.
no one knows if these high-risk pregnancies will end with a broken heart
Vasa Previa has 50% mortality.
or with sweet dreams. Baylor University Medical Center in Dallas, Texas is a lone star when it comes to high-risk pregnancies and neonatal care. So when Lacey Carter learned her pregnancy was in grave danger, she wanted the best care she could get.
I'm 27 years old, and it's my first time to be pregnant, my first baby. It's really scary to be in the hospital.
Lacey was admitted 6 weeks ago with her husband by her side.
We were actually on a road trip, and I just started leaking.
It was amniotic fluid. Lacey's membranes had ruptured, and it was far too early to risk delivery.
I was really scared because we were at 23 weeks, and we have a friend who had a baby at 24, and I know that they went through a lot. Survival rate at 24 weeks is very low.
Premature rupture of membranes is relatively uncommon, and when it happens, it draws a lot of attention.
Because it's extremely dangerous. With the baby no longer sealed off from the outside world, an infection can take hold at any moment.
Well, babies that are severely infected can die.
They know I won't go full term. They don't know when I'll have the baby, but, you know, and just thinking about most people leave the hospital with their baby, but I know that I won't. That's really hard.
We gave her some antibiotics to lessen the risk for an immediate infection, and we gave her some steroids, betamethasone, to help induce fetal lung maturity sooner.
But will it be soon enough? Today, Lacey has suddenly gone into labor.
We suspect that an infection has finally set in. That's what usually starts the contractions. So we're going to have a baby here shortly.
Shauna Blocker came to the hospital early today with a severe headache and extreme high blood pressure. She's 36 weeks pregnant.
Well, I packed my bag, but I still didn't expect the doctor to send us to the hospital today. Because we're 24 days early.
Shauna is a 35-year-old patient of mine who has had 6 pregnancies and 3 deliveries, 2 of which have been complicated by pregnancy-induced hypertension.
Shauna's husband, Gordon, has been worried, for good reason. Shauna's condition, also called preeclampsia, can lead to seizures so severe they could stop her breathing. It also endangers the life of her baby.
The placenta could abrupt, which means it shears away from the uterine wall and compromises the blood supply to the fetus.
There is only one known cure: immediate delivery of the baby.
Whatever it takes to ensure both my safety and the baby's, we're willing to do it.
It's 146/98.
With her blood pressure way too high and still rising, Shauna is immediately put on a drip of magnesium sulfate to ward off seizures and Pitocin to induce labor. They are in a race for their lives. When she was only 15 weeks pregnant, Tanya Konarvik and her husband Shay got devastating news. They learned that their twins were in the same amniotic sac and were not likely to survive.
We saw early on in the sonograms that umbilical cords were tangled up with each other and around babies, and you know, that's a concern.
At any moment, one of the babies could simply roll over, twist the umbilical cords, and cut off the circulation to the other.
We tell patients that only 40% of monoamniotic twins are going to survive, so less than half make it.
We were really scared about if something happened before 24 weeks, they couldn't do anything. There was nothing they could do. And so we just waited and waited and waited.
One down, one to go.
Monoamniotic twins are very rare. They are about 1 to 2% of twins. Twins are about 1% of pregnancies, so this would be about 1 to 2 per 10,000 pregnancies.
Perfect.
But so far, Tanya has been very lucky. Both babies are still alive.
And now I'm 34 weeks, 3 days, which is pretty far along for these types of twins since they usually deliver around 32.
Hello, how are you?
Tanya has been hospitalized for the past 10.5 weeks, ever since the twins became viable.
Tanya's gone further than any other mom I've had with monoamniotic twins. Yeah.
But things can change quickly.
Nope.
Imelda Armendariz and her husband Lorenzo have 2 healthy children at home, but they are worried that their third child's very first experience may be a major lung surgery.
It was actually at 20 weeks when I had my first sonogram done back in Odessa. They noticed that she had a cam in her left lung. It's a cyst that grows in there.
The tumor had pushed the baby's heart over on the right side of the chest. And so there was a great deal of concern that the baby would develop heart failure.
When I found out, I got really scared. I got depressed because I really didn't know what was going to happen. And I was scared to think that my baby would have to be operated right at birth.
The problem with the CAM, if there is residual tumor, is that there's a tendency for malignant transformation. So these turn into tumors, into cancers, if they're not removed.
Today, there is a glimmer of hope. The tumor appears to have decreased in size.
We're not going to know for sure how big that is until the baby is delivered.
And there are other serious risks.
Problem 2 is that she had a cesarean section in her previous, in fact, her first pregnancy. The risk is that the previous cesarean section scar can tear open, that it can rupture.
I'm gonna be nervous, I know that. Because, you know, I don't like the hospitals and I don't know. I just scared sometimes.
Well, we got the call that Lacey's complete and we're about to have a baby. We'll make sure the special care nursery team is present and we'll go in and have a preterm delivery.
At 29 weeks and 4 days, it's far too early, but there's no turning back now.
Won't be long though. We need to get special care here first, okay? Okay.
It's pretty awesome.
Yeah.
I got the nervous stomach. Okay, head's right there, Dad. You want to see it? Baby's head right there. Yeah, you're telling me.
Can I push?
Deep breath in. There you go. Curl up. Curl, curl, curl. 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Let's take a deep breath in. Hold it and push down. Bear down. Push 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. Deep breath in. Right back in.
Which long till the head comes out? Oh. That's the head?
Teeny tiny top. You ready? Deep breath in. And push down. 1, 2. Good. Come on, push it
There you go, baby. Come on.
3.
Push it out. Push it out. Push it out.
4.
Push it out.
Oh, look at her little face.
How incredible is that?
Oh, look at little her faces.
There you go. Oh, she's out.
Oh,
baby.
she's here.
She's out. Look at her.
10:34. Slide on them here. Little one. Oh, she's cute.
But there's a problem.
You know, she's not breathing well on her own, so we're going to help her with the breathing right now, okay?
How much she weighs yet?
Not yet. They've got other things on their mind right now besides weighing her.
Toby is Hebrew for the Lord is good.
Lacey Carter's baby girl weighs only 2 pounds, 14 ounces, and she is struggling to take her first breaths.
What we're giving is Cervanta. It's a kind of surfactant which a lot of premature babies don't make. And so when you give this early on, actually right away at birth, it helps the baby's lungs to open up better.
And then when your baby's ready to tolerate feeds, she'll either be nippling.
Absolutely amazing. It's just incredible.
Now, once we go upstairs, we're going to hook the baby to the breathing machine. And we're going to put some lines in the belly button. One line is to do the blood test, and the other one is to give glucose and, nutrition.
It appears Lacey's ruptured membranes have made the usual problems of prematurity much worse.
When the membranes rupture early, there is less fluid around the baby, and that may hamper the lung development. So you not only have immature lungs, you have lungs which haven't grown to the full potential.
She's gorgeous.
Okay, I'll see you again a bit later.
The staff of the Neonatal Intensive Care Unit is little Toby Lane Carter's only chance of survival.
What'd I say?
Did you just hear that cry?
Was that her?
Yeah.
They have to get her on antibiotics right away.
Risks of infection for a baby are very severe, especially for the premature baby, because their immune system's not completely developed. They don't have as much. Oh, it is? Okay.
But first, they need to get her to breathe.
She's in, but it doesn't sound good. She sounds tight, or she sounds...
She's real non-compliant.
Yeah.
Soya, how you doing? Gonna monitor, all right?
Solia King had been having irregular bleeding for months. In the emergency room, she got a huge surprise. She was 5 months pregnant.
I felt like I was pregnant, and I'd been having bleeding, so I thought I wasn't.
This is the ultrasound. We're gonna listen to the baby's heartbeat.
Solia is single, but always wanted to have a child, if she could.
I'm 39 years old, and this is my second pregnancy. I'd had a previous miscarriage, and that was years ago. And so when I found out I was pregnant, I was really happy.
There she is.
But the bleeding continued, and just a couple of weeks later, a doctor discovered an extremely dangerous condition.
What she has is a Vasa Previa, which means the fetal blood vessels from the umbilical cord run right across the cervix. It's these two vessels that are tracking right in front of the cervix. The red is blood that's actually going in that direction, and the blue is blood that's going in this direction. So one of these is an artery and one is a vein. And the risk is that if she ruptures membranes, if she goes into labor, it can tear through those vessels and the baby starts to hemorrhage.
But this baby has become the most important thing in Solia's life.
When I watched the sono, I just fell in love with her. It was such a surprise because I didn't even expect it, and I was looking at her, and she was real active and beautiful, and so I was all happy. And the bleeds that I got after that, every one of them was real scary.
Solia had good reason to be scared. This condition, occurring in only 1 in 3,000 births, is frighteningly dangerous.
If there's a rupture through one of those vessels, that baby will bleed to death within 3, 4, 5 minutes.
Solia has been in the hospital for 11 weeks, afraid every moment that early labor or a sudden movement could result in the loss of her baby.
It's frustrating because you're not in control of it. It's you just kind of sit with it and pray.
Her spirits are affected that she's here, a long way from home. As nurses, we become our patients' extended families.
Even though the baby appears to be a little underweight, a C-section has been scheduled in 2 days. She's too close to term, and the risks of going into labor are too great.
Chances are that if we're not as quick as we need to be, that we could lose this baby. That baby's life is in our hands.
With each contraction, the baby's heart rate's going down a little bit.
In a race to deliver her baby before Shauna's preeclampsia turns into the life-threatening seizures of eclampsia, doctors discover a new problem.
Well, the baby's coming out head down still, right? Normally, the baby's face is down so that the smallest part of the baby's head is trying to come out the vaginal canal. She's flipped up, looking sunny side up, so that the largest part of her head is trying to come out first. So it's just a lot harder to push. You're going to turn these 50.
Shauna lies on her side to encourage the baby to turn herself around. It's an uncomfortable position, but now, whether they like it or not, they just have to wait.
You'll see with every contraction.
Over the next 3 hours, the baby does turn, and Shauna tries to nap. But at just past 8:30 p.m.
Shauna, I'm going to check your cervix. See if, because these variables are kind of coming back on me. Okay. I'll just move your legs for you if you don't mind. Your fingers and some pressure. Well, hello, Miss Gracie. That's why your heart rate's going down a little bit. We are definitely complete. I am going to turn you back on your side because I don't want to have a baby. All right, so we're complete plus 2. That baby's right there. We need to get Dr. Amer here, and we're gonna have a baby.
Extra large for my dad?
Yeah. Here's your shirt.
I checked in 10 weeks ago because at 24 weeks, the babies are considered viable. And so if they saw something wrong with their heart rates, having what's called decelerations, then they would deliver them early.
It's been a long, trying wait for Tanya and her husband, Shay.
It's the hardest part is just being away from home. It gets a little enclosed sometimes.
But finally, the wait is over.
Okay, well, let's get your other gown on.
Even though the twins are still dangerously premature, the risks they face in the same amniotic sac now outweigh the risks of a controlled delivery by C-section.
The reason we do the cesarean section is so that we can deliver both babies expeditiously. In the rare cases where I've had monoamniotic twins deliver vaginally, then you really have to worry because as the first baby delivers, it may tighten the entanglement of the cord, and you don't know how quickly the second baby will deliver.
I got the sheet, I didn't get a gown. They said the gown wasn't big enough.
Now, Tanya is headed to the OR. Relief and delivery are close at hand, but even if the twins survive the difficult C-section, they are still premature, and the tangled cords may have caused some unexpected problems.
This is exciting. Labor and delivery. Dr. Amer, we are complete plus 2. I mean, it is right there. It may even be plus 3. He said, let's go ahead and start pushing a little bit. We may push once and I'll ask you to stop, okay? Oh, here's Dr. Amer.
How you doing? Are you nauseated?
I haven't felt any pressure.
Moments later, A contraction begins.
Okay, go ahead and take a deep breath in, hold it, and bear down. Push real hard. Push hard forward. Excellent.
Great.
Good. The head's right there.
All right. See the baby, babe.
All right, you're having a contraction. Push, push, push. Good.
Yeah, babe. Wow. Holy Toledo.
No more pushing. We're going to see if we can let this baby come on out all by itself. There we go.
Oh my God.
Looking
She
right
is
toward
ball-headed.
your-
A ball-headed little Gracie.
Already crying and we're not even out. Oh, biting my finger. Woohoo! Chomper City here.
Oh, there we go.
Okay. Give me another little push. Take a look down here and see this little baby.
There's our cord. There's a little cord.
Okay.
Right, Amber.
Oh,
right.
we got
Hi,
a
Miss
beautiful little
Gracie.
girl here.
Hi, Miss Gracie.
Spit it out, you.
Look how ball-headed she is, Shauna. She's beautiful.
Shauna's delivery went very well. She delivered a 5-pound, 12-ounce girl. Baby did remarkably well.
Did you get caught?
Shauna is still in danger, but now baby Gracie is safe. So for the many members of the Blocker family, that means celebration.
Oh my goodness.
That's so sweet.
She's my 17th grandchild. Yes. 17th precious grandchild. You just don't know what a big family you just grew into. Say hi.
She's too happy to show it, but Shauna is still having headaches.
These headaches are because of swelling in her brain as a consequence of the preeclampsia. We'll have to monitor her very closely that she doesn't have seizures or a stroke. So she is certainly not out of the woods at this point.
Dr. Anderson has decided to do an amniocentesis on Imelda. By extracting and testing her amniotic fluid, he can tell whether the baby's lungs have fully matured. Chances are 9 out of 10 that they have, but...
Because if they're not mature, we ought to really think about, is it wise to deliver a baby that may have a lung surgery whose lungs aren't ready?
So they proceed as a precaution.
Okay, we're going to prep your abdomen with some iodine solution. And then I'll use the ultrasound so we can see where the fluid is and where the baby is and where the needle is all the time.
If the test shows that the lungs are mature, they will begin induction immediately.
Just fine. Fluid's coming up nice and clear. Everything's going well.
Now they have to wait. But with so much to worry about, waiting can be hard.
And the needle's out. Okay.
Only what you have to do is relax. Don't be scared. Don't be afraid. And after the storm, come the calm. That's only what I know.
This morning, Solya's nurse, Kelly, noticed a disturbing warning sign.
During my assessment of the normal routine monitoring, I noticed that there was a change in the baby's baseline. The baby had an increased heart rate, which to me was not reassuring.
Kelly pages a doctor to let him know the baby's heart rate has gone from 120 to 170. To make matters worse, Solya has been having contractions through the night.
Dr. Rosas is going to, review this
and thinking about my baby and worrying about if she's okay, and you want to nurture her, you want to protect her. You know how special that she is just for being here. And I want her so bad. I want her to be healthy.
If Solya is going into labor, the blood vessels across her cervix could rupture, and hemorrhage uncontrollably.
If we don't move quickly, we could possibly lose both mom and baby.
And there's great fetal movement.
Solya's contractions and the baby's surging heart rate indicate the beginning of labor. This would be disastrous, as the blood vessels across the cervix would rupture. After paging a doctor, Nurse Kelly Creighton checks again.
Okay. Baby's heart rate looks like it's back down.
Back down to normal.
Could have been an after effect of the medication that you had to receive last night for the contractions.
Yeah.
And she may have just been telling us that she didn't like what was going on, you know.
Solya's baby has survived the morning, but there's 24 hours to go. And if the blood vessels to the baby don't rupture prematurely, they'll surely rupture during tomorrow's C-section. The baby continues to be in danger every moment.
I'm scared, but I can't even allow the thought that anything bad's going to happen. I wait up a little
now. My name is Rosa Coronado, and I'm here to be induced. I'm 35 weeks, carrying twins.
Rosa and her husband Louis have 2 little girls at home, and today they are having non-identical twins.
We thought we were going to have all girls, so we got lucky with one boy.
Now they are having second thoughts about the plan.
We were just wondering, you know, being induced, is it really necessary? Could we wait till they came natural?
The babies are fine at the moment, but there are some serious concerns. Rosa's amniotic fluid is low, and that's a sign that the placenta is getting tired.
The placenta, which is the lungs of the baby, which is the filter that brings in oxygen, nutrients, and everything the baby needs to survive, is not working as well as it was before. So you have to respect that very, very much.
And there's another complicating factor.
She really wants to have vaginal. She doesn't want cesarean.
Are both babies head down?
Yes.
Rosa Coronado is having twins, and in general, twin pregnancies are high risk because they're not normal. The norm is a single baby.
Just questions we, you know.
Sure.
Doctor, you know.
Remember too, you're carrying twins, and once you have multiples, it's a whole different ball game.
Right.
And a little more controlled delivery is preferable, because anything can happen. And, you know from being parents before that all the possibility of things that can happen in the course of a labor and delivery with one baby, and now we've multiplied that by 2. Right. So.
Dr. Branning wants to deliver in the OR with an emergency C-section team standing by.
Labor is a fairly violent process. While it's a very natural process, things go wrong. I mean, look several centuries ago, we had a 50% mortality rate with mothers and babies.
But all the dangers in the world can't stop Louis from being excited.
We feel good. We just need, we just had some answers. That's it. But other than that, I'm ready. I'm happy. Yeah. Especially after having my first boy.
Lacey and David's 2-pound, 14-ounce baby girl is tenaciously clinging to life.
I wouldn't say the baby's completely out of woods. I would say the baby's, stable.
She's been working on some jaundice. It's okay.
Oh, it's the first time I heard it cry.
The jaundice is because Toby's young body is rapidly making new blood cells and breaking down old ones. This process creates bilirubin, more than her immature liver is able to process. Fortunately, there's a very simple way to help break it down.
The lights are a real safe way of treating that and helping it to come down so you don't have to do anything extra on top of that. She also has an immature intestine and immature lungs, and we have to watch that.
When we first came in yesterday, though, she had a lot more tubes and stuff. So when we came in today, it was really exciting to see the progress she'd made just in one day.
After 13 hours of attempting to induce, the effort is abandoned, and Imelda is prepped for a C-section.
Big push. Here we come. Yay!
Exhausted and happy, Lorenzo and Imelda have their beautiful baby girl, Isabella.
To get her first shot, so I'm sure she'll.
Baby looks good. Weighed about 6 pounds, 3 or 4 ounces. Good APGARs, so was breathing well.
But what no one can see is what is happening inside the baby's left lung.
Today or tomorrow, they'll do an MRI scan or a CT scan of the lungs and look for the tumor.
Comfortable? Yeah, well,
So far, Tanya's twins have survived their tangled umbilical cords. And even though they are premature, Tanya's doctor doesn't want to risk waiting any longer.
Okay, all set? Okay, skin incision. Can I have pickups and what's this? Yeah. Got that one, great.
But you don't want to say nothing more. What's your was on?
Little under pressure. Ooh, nice size baby.
Here's A.
Within minutes, both babies are out. And at first, they look good.
I tried. Obviously not very successful.
Your cord, though, that is amazing. Yeah. Oh, yeah. Totally intertwined and in knots.
With knots that severe in the umbilical cords, it was amazing the twins survived.
It's always true of monoamniotic twins, but it was certainly true in Tanya's case that with the umbilical cords knotted around each other.
But there's a problem. It looks like the tangled cords might have constricted their blood supply and slowed their development.
Yeah, her color is not good, so give her some extra oxygen, helping to open up her lungs a little bit here and see what she does.
She doesn't have enough oxygen in her blood. They're going to go to the NICU.
Just minutes old, the Kanarvik twins are not getting enough oxygen.
Her circulation is just not working as well as we would like for it to work. Yeah, you can see where that cuff was right there, how that it's taken a long time to turn pink again. What we call a capillary refill is a little sluggish, so she may need a little bit of extra fluid in her circulation.
We're going to continue to monitor and then run blood gases, and we need to do a chest x-ray to see what's going on.
For a moment, the twins appear to improve, and Tanya is brought to the NICU to see them.
They're real. Yeah, she said they're real.
I'm glad they're here though, because now they can get stronger and come home. Hi, babies. I think we have to go.
She's having a little trouble breathing, and that's the grunting that you hear. So we have her on CPAP, which is just some nasal prongs in her nose that gives a little bit of pressure into her lungs and helps her breathe.
She's getting worse.
My baby's doing good.
It is late, the day before Solya's C-section, and Solya's mom, Pamela, has arrived with Nancy, the mother of the baby's father.
I have 2 girls and 2 boys, but this is the first grandbaby that my daughters have had. And I don't know, it's just a little special.
Hello, how are you?
But Solya is anxious because a friend has sent an article about Vasa Previa.
It said that there was a greater than a 50% chance of mortality, and that's what's got me. But
You know, not diagnosed, Vasa Previa has 50% or more, probably higher than 50% mortality. The difference is when it's recognized ahead of time.
But Dr. Anderson doesn't want to tell Solya how risky it still is.
The placenta's on the front wall of the uterus, and we'll make the incision in the lower part of the uterus, and when we make the incision, we're probably going to go right through the placenta. And so what that means is that as soon as we cut through the placenta, both mother and baby start bleeding. We're going to make the uterine incision, get to the baby's umbilical cord, and clamp it as quickly as we can.
Rosa Coronado is being prepped for a very risky vaginal delivery of twins. She is 4 centimeters dilated.
Did we get a pink one and a blue one?
The pink one's
On the boy?
on the girl.
The boy.
Which one is it? Is it the boy? You got,
It's just like it doesn't matter.
Hello.
Hey, Dr. Brad.
How are y'all?
Hi, Dr. Brandon.
Morning, how are you doing?
Okay.
The levity conceals the fact that Dr. Branning is worried about all that can go wrong.
We're used to.
With Rosa, the risks come with things like prolapse of the cord. This can occur with multiple births because there's so much moving about that you can get a little gap that the cord can kind of pass the head, and that's a real emergency.
Despite the risks, a vaginal delivery is important to Rosa. A C-section is a major surgery after all.
I've never had a C-section, but I just always heard from, that it's just a harder recovery. And then with twins, I didn't want to go through that to be able to take care of them.
If we have a problem, we can switch over to C-section pretty quickly.
The plan is to have a double setup. Rosa will be prepped for a C-section and will deliver in the OR. So if something goes wrong,
We can get a baby out in 45 seconds, a minute, pretty quickly. Did we ever confirm boy on 2?
On 2, yes.
Okay, but we're not 100% sure on A?
Right.
Okay, so Catalina very quickly could become Carlos. There you go.
Hi, Toby.
for David and Lacey Carter, the worst is over. From when she suddenly went into labor to the depth of their attachment today, nothing was what they expected.
The delivery wasn't exactly what I would expect. It was really fast, which is a blessing, but it was really scary.
Now they can go home, but they're leaving a piece of their heart behind.
I don't know, something happens when she's born. It's just, something happens and you just know that she's yours and you love her so much. You just want to take her home.
Okay.
See you tomorrow.
Yeah, we'll be back.
Don't worry.
Don't worry.
Are you ready to have these babies, Rosa? Okay.
Even before Rosa's epidural has fully taken effect, she is rushed to the operating room. Baby A is coming down fast.
Even though she's in pain, that's going to help her push quite a bit. So we'll get her to push there, get baby A delivered, and then you basically kind of see what you've got. Like I said, it may be several minutes, maybe 15, 20, 30 minutes between deliveries of the twins, but usually not, usually within about 5 minutes of each other.
You ready to be a papa? All right, you're on.
With an emergency C-section team in the room, Dr. Branning is ready to go.
We're all ready, Rosa. Next time you have contractions, we're going to get you to push, okay? Yeah, I want to take a big deep breath for us.
Take a deep breath.
Hold your breath and push down.
Bear
Push,
down
push,
to your
push,
bottom.
push, 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 push. Awesome, awesome, awesome job. Okay, slow down, slow down. Okay, let's see what we got here. We have a little tiny girl. Hello there. Hi. Would you cut for me?
Yes, sir.
Right between the clamps.
You got it.
There you go. Don't cut the doctor. There you go. Good job. Come here, girl. Big stretch. Big stretch.
Get her off the leg. It looks good.
Yeah, she's beautiful, Mom. She's okay.
But the boy that Lewis is praying for is still to come. And it's the second twin where things can most easily go wrong. Despite the many risks of delivering twins vaginally, Rosa's baby girl came out perfectly. But it's with the second twin that there are the greatest dangers. And twin B is coming down as quickly as the first.
Yeah, we're going to go ahead and break the water now. Just the baby's head is filling the cervix nicely. There's no gap around it.
Big deep breath.
And
push down. Around. Bear down on your bottom. Push hard. 2, 3,
Good.
4,
Good.
5, 6, 7, 8, 9.
Awesome
10.
job.
Good.
Awesome job.
Rosa,
Blow it out.
Bear down. Push hard on your bottom. Push. 2, 3.
Heads out. Okay. Nice gentle push for me. Gentle push. Gentle push. Okay. Hello, young man. How are you doing? Happy birthday. It's definitely a boy. Yes, I know.
Look over here. Look at all his hair. I'm right here, buddy. Hey, buddy. You got my nose.
Is that good?
Shooting for her nose. Yeah, buddy. What's up? Huh? It's okay.
Right between there.
It's all right. I'm coming. I'm here.
Good.
Right here.
Hello, young man. Nothing to it.
And the news just gets better. Both babies are doing great.
Okay, Dad.
Here we go. You ready? Oh, yes.
How does it feel?
Great. I just won the lotto. This is my reflection right here. Look at that. Look. You did great, Mo. You did great.
24 hours later, Tanya and Shay's twins are doing much better.
She has a tube because she is still getting every other feeding through her tube because she gets really tired from sucking on the bottle. And this is Penny and this is Marissa. Hopefully they'll be coming home sometime next 3-4 days probably. I don't know if I'm ready to bring them home. I want to bring them home, but I don't know if I can handle it. It's gonna be rough.
Tanya and Shay will still have to wait to bring their miracle babies home. But after 10 weeks and a life and death struggle, their ordeal is over.
They're in good care. Right. It's bittersweet because I get to go home and they have to stay. See you tomorrow.
Ready or not, here we come.
Solia King is ready for the biggest moment of her life. But it will also be one of the most dangerous. The blood vessels to Solia's baby are sure to be severed by the C-section. Getting the baby out quickly will be a matter of life or death.
How you doing, Solia?
Doing all right.
Good. Okay, skin incision.
It's too late to turn back now.
A little muscle incision there.
What a wonderful day. I hope she has your green eyes.
This is where we don't want to waste time. Solia, we're going to make the incision in your uterus, so baby's going to be in about 30 seconds. Score it. Okay. Uterine incision. Okay. Okay, Alice. Oh, look at those vessels. Ah. Try to go between them. No. Okay, good.
The bleeding has begun, and the baby's life may be slipping away. Unable to get a good grip, the doctor calls for a suction device.
Yes? Well, that's okay. Hang on a sec. Yes. Okay, do it. Perfect. Oh, what a cute little baby. Okay, suction. Super. Okay. And give her a little extra blood there.
Just giving them some extra oxygen.
You're going to the Well Baby Nursery. Oh, goody. Oh. I love it. Congratulations.
Say, here I am, Mama.
After months of constant danger, Solya's baby is safe. No dream could be sweeter. Gracie Blocker is doing fine, and so is her mother. Shauna's headaches are gone.
I've prayed that she'll really add a great dynamic to our family with our 3 other little children, that they'll really welcome her, and we'll become the Blocker 6 now.
I'll just take a look at her. We're becoming very fast, quickly attached.
Hey. It's such a miracle every time. I've seen it happen 4 times. It's miraculous every time you watch it happen.
The results of little Isabella's MRI have come in, and the news is next to miraculous.
It appears that it's a normal newborn film. Whatever they thought they may have seen over on the right-hand side appears to have been resolved.
The tumor is gone. Imelda and Lorenzo are overjoyed.
They tell us today the lung is pretty good. And, well, we're so excited.
I'm looking forward to going home and taking the baby with me.
I feel great. A little bit sore, but she's beautiful.
The most fun part is when she's happy and alert and having a good time and smiling, and you know, you can tell when she feels good. And just keeping her feeling good is fun. It's very rewarding.
Times like this, you find out that you are loved and appreciated, and it's brought that out in our family.
Now, Solya and baby Erica will go home to start their lives together.
If I could have anything in the world, it's what I want right here.
It's what all the mothers at Baylor University Medical Center have hoped for. They have overcome tremendous obstacles.
It's okay.
And a special delivery has made their sweet dreams come true.